Good morning, everyone, and welcome to episode 6 of Sprout HR Experts by Sprout Solutions. Hi, I'm Katrine, and I will be your host for this webinar. Thank you so much, everyone, who took time off their busy schedules to join us today. We will have another exciting episode for you in today's Sprout HR Experts webinar, as we will be talking about the different guidelines and policies every employee and organizations should be aware of. With the ongoing pandemic, it is important for us to be in the know-how on how we can be secured with our overall well-being by letting ourselves learn about the different mental health policies in our workplace. If you like webinars like this, please don't forget to follow our social media pages at Sprout HR Tech and be on the lookout for all new episodes. Also, we are live on Facebook and YouTube as of the moment. So just to give a quick introduction on who we are, Sprout Solutions is the leading HR and payroll solutions provider in the Philippines that aims to help businesses transform and automate their HR processes. Just like the new normal of virtual festivities and Filipino spirit, we welcome innovations by helping your business adapt to the new normal digitally. So once again, a hearty welcome to everyone tuning into this exciting episode of Sprout HR Experts by Sprout Solutions. So I'm sure you guys are looking forward to learn more about today's topic. But before we get into that, let's start first with a short icebreaker. So to join, just simply answer the poll that will be popping out of your screen. So for our poll, how do you take care of your mental your mentally, and how do you take care of yourself mentally with the ongoing pandemic? So first is you keep in touch with your family and friends, you meditate the stress and negativity away, of course through retail therapy, or you disconnect with social media and give myself a much needed mental health break. So parang karamihan ng ating mga attendees is keeping in touch with friends and family. So just to share, sa akin kasi what I usually do is I work out every morning. So parang I at least 1 hour a day nag-workout ako para lang hindi ma-stress kasi mahirap na lalo na during the pandemic we're stuck lang sa ating mga bahay. So most of our attendees is doing it by keeping in touch with family and friends. So okay. Yeah. So, okay. So, thank you so much for sharing all your answers. Moving on, let's start spicing things up. Now, for those of you who have been tuning in with us for a while, you already know what's coming. What comes next? You guessed it, there will be a raffle towards the end of the webinar. So, all you have to do is collect the 3 keywords. And throughout the webinar, follow our Sprout Twitter page at Sprout HR Tech and comment all these 3 keywords on our Twitter page. We will be announcing the lucky winner by the end of the webinar. So make sure you tune in as we uncover everything for today's topic. So now I'm sure you guys are excited to know the raffle keyword. So here we go. So ang ating first raffle keyword is wellness. Again, the first raffle keyword is wellness. So while you guys are logging into your Twitter accounts, I just want to let you know that there will be a fireside chat session later where you can ask our panelists questions about today's topic, which is guidelines for the implementation of mental health workplace policies and programs for the private sector. So start listing down your questions and we will be addressing as much as them later on. So now I know you guys are excited as I am. So without further ado, I'd like to introduce today's speaker. She is currently the Senior Labor and Employment Officer of the Department of Labor and Employment, Bureau of Working Conditions. She is also a resource speaker and lecturer in the field of occupational safety and health with various training and local and abroad on OSH as well as leadership and supervisory trainings. She is also a member of the technical working group in formulation of DOLE's various workplace guidelines on OSH. Everyone, let's give a round of applause to Ms. Jennifer Obien.
Hello, good morning everyone. Yeah. So, okay po ba yung aking sound? Clear po ba?
Yes po, clear po.
Okay. So, again, good morning. I'm Jennifer Obien from the Bureau of Working Conditions, and we are grateful po for inviting us to share with you guys yung aming pong guidelines specifically for the mental health promotion at the workplace. So, moving on, bago po natin i-discuss fully about yung guidelines po natin, let's talk about mental health. So, kanina po, may nagkaroon po tayo ng poll. So, same thing po. When we heard the word mental health, ano po ba yung nasa sa isip natin? How would we respond when we heard the word mental health? So, ito po ba ay patungkol lang doon sa mga individual who are suffering from mental health issues or mental health concern? Or mental health is equally important as our physical health? So, some would say, now when they hear the word mental health, they will think of those people with mental health condition. But moving on my next slide would show the definition of mental health. So as per World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her normal own potentials, can cope with the normal stresses of everyday life, can work productively and fruitfully, and is able to make a contribution to her or his community. So mental health really affects the way we think, the way we act, the way we behave to a certain event or situation in our life. So pansinin po ninyo, pagka kayo po ay nakakaisip or nalulungkot po, ano ang nararamdaman ninyo? How would your body respond to it? Because our mental health, meron po yung interconnectedness between our mind, our emotions, and our physical body. But pag nagkaroon po ng problema, ang isa doon, there would be a great disturbance. So moving on my next slide po would show the definition naman po of the mental health condition. So ito na po yung sinasabi nating nagkakaroon po ng problema sa pag-iisip. So as defined by the World Health Organization, mental health condition is a neurologic or psychiatric condition characterized by the existence of a recognizable, clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. So, giving emphasis po, no, there is a significant disturbance on individual cognition or comprehension, emotional regulation. So, hindi niya na makontrol yung kanyang emotions or behavior towards a certain event or to a certain situation. So, but before we can say that a certain individual is suffering from a mental health conditions, kailangan po merong assessment na gawin. Meron pong mga pamamaraan para po malaman kung talaga nga po siya ay may mental health conditions. So, sino po ang gagawa niyan? Of course, our mental health experts and our mental health professionals. Because kailangan nga daw po magkaroon ng scientifically accepted medical nomenclature and best available scientific and medical evidence before the doctors or our mental health experts can declare an individual with a mental health condition. So, hindi po nangyayari overnight ang mental health disorders. So, yan po ay meron pong prosesong pinagdadaanan. So, from the start pa lang, na meron na tayong makikitang signs or mental health issues and concerns, we don't want that na mag-severe or mag-progress pa po ito into a mental health condition. So that is why kailangan meron po tayong gawin. We really need to take care of our mental health. Moving on, I would like to share with you some statistics we gathered. So ito pong mga statistics po na to or data po na ito ay gathered before or during crafting of the mental health law. So ang sabi po sa ating data, our available data right now, over 450 million people suffer from mental or neurological disorders. And the World Health Organization predicts that by 2030, businesses will lose approximately 12 billion workdays due to absenteeism of those individuals with suffering from depression and anxiety disorders, no? So, nakita niyo po, yung data na yan as 2015 pa po. But right now, knowing that we have this pandemic, mas dumami po ang nakaka-experience ng fear, mas nakaka-experience ng depression, and anxiety disorders. So kung wala po tayong gagawin, baka wala pa pong 2030, na-reach na po natin yung 12 billion lost work days. So worse po, no? Baka mas madami pa po, hindi lang po 12 billion work days. And also, 9 out of 10 people with mental health condition experiences stigma and discrimination. So still, mental health is a sensitive issue in our country. Hindi pa po siya ganoon ka-accepted sa atin or ka-welcome sa atin, those individuals with mental health conditions or mental health disorders. So, most of them nakaka-experience po talaga ng stigma and discrimination around the world po. Pero itong data po na to na 9 out of 10, this is specifically in the Philippines po. And nakakalungkot din po that we have a 2,558 suicide cases caused by mental health problems. So those mental health issues, mental health problems na hindi po na-address, hindi po nabigyan ng tamang assessment, hindi po nabigyan ng interventions, then it progresses into a mental health conditions, pushing this individual who experiences stigma and discrimination, pushes them to commit suicide. So, ayaw na po nating madagdagan po yung ating cases ng suicide. Lalo na nga po ngayon, nakakalungkot nga din po ulit na isipin that alam ko naman din po na aware kayo that we have data on suicide cases because of the pandemic. And an estimated 4.5 million Filipinos projected to be suffering from depression or any mental health issues. So, ako po, masasabi ko po na kahit po ako ay isang mental advocate, pinagdadaanan ko rin po ang mental health issues. But good thing that we know how to take care of our mental health, we can cope on with our everyday stresses. So it is important really to take care of our mental health. And because of these increasing numbers or increasing statistics on mental health concern, moving forward please, nagkaroon po tayo ng issuance ng ating pong batas. So we have the RA 11036, which is an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons, utilizing psychiatric, neurologic, psychosocial health services, and appropriating funds therefore. So ito pong batas natin is also known as the Mental Health Act. So it ensures the protection and promotion of mental health of every Filipino, as well as to take care of those individuals suffering from mental health disorders. Moving on, the Mental Health Act was enacted on June 20, 2018. So kung titingnan po natin, no, 3 years old na po siya. Kumbaga po sa bata, toddler pa lang po, talagang nagsisimula pa lang. Then it was signed in 2018 and it took effect on July of 2018 din po. And its IRR was issued in January of 2019 and the IRR took effect on February 19, 2019. So moving on, ano po ba yung sinasabi or salient features of the law? Actually, madami po siya, mahaba po yan. But we have gathered some salient features of the law, which is, we think that is important to us, lalong-lalo na po yung nasa workplace. So, the law would say it makes treatment available at all levels of national health system. So, as we all know, the existing health system po, kapag meron po tayong mental health cases or meron po tayong mga kakilala na nagkakaroon po ng problema sa pag-iisip, ano po yung unang naiisip natin na pagdalhan sa kanila? It is the National Mental the Mental Hospital previously. Ngayon po NCMH na siya or National Center for Mental Health. So, kumbaga, nagkakaroon din tayo ng parang constant na sinasabi, oh, dali na yan sa mental hospital, din yan sa Mandaluyong, sa loob. So, yung may mga ganun po, no? But with the passing of the mental health law, sinasabi po na kailangan the treatment, that the medical or the mental health services should be available at all levels of national health system, even at the community level po. So, ang objective po ng batas is maibaba ang ating mental health services even at the community level. And si DOH po ang nag-aasikaso po niyan together with the DILG. Then also the law would mention about the integration of mental health service into the Philippine General Healthcare System or ito po yung ating PhilHealth. Sadly po, no, on our existing PhilHealth coverage for this individuals with mental health condition, nasa 7,800 lang po. So that is maximum upon confinement. But then, with the passing of the law, sinabi po niya, inatasan po niya ang ang ating pong PhilHealth that they should develop a more comprehensive healthcare package for those individuals with mental health conditions. So hindi lang po nalilimit doon sa 7,800. So yan po ay kasalukuyang ginagawa po ni PhilHealth para po mapalawig yung ating pong coverage under the PhilHealth system. It requires government agencies to spread awareness in school, workplaces, and communities. So that is why nandito po si DOLE because of the workplace setting. It requires mental health professionals, workers, and other service providers to undergo capacity building and reorientation trainings to be provided with the ating pong sa ating pong mga empleyado. So, meron pong kakulangan doon po sa ating mga mental health experts. But with the passing of the law again, sinabi po niya na kailangan mag-create tayo ng mental health professionals. These mental health professionals not necessarily mean na mga medical people lang po. But then, they can be naman po, provided meron lang pong training or tamang training na pagdadaanan po. They can be called mental health professionals. Sino-sino po ba sila? Our HR people, our OSH personnel, our nurses, our OH nurses, our safety officers, our first aiders, can be also a mental health professionals. Provided nga lang po, dapat meron pong capacity building na mangyari po sa kanila or maibigay po sa kanila yung mental health trainings needed. Now, also, the law mentioned about the creation of the Philippine Council for Mental Health. So this Philippine Council for Mental Health is composed of different national government agencies together with the academe and the civil society organizations. So sila po yung council na tumitingin po for the full implementation and monitoring of the Mental Health Act in the Philippines. So the law also provides penalties for violations. So moving on, yung atin pong RA 11036 or yung atin pong Mental Health Act is siya po ay rights-based. So sinabi po na ang ating mga individual or ang mga tao na meron pong mental health condition ay meron din pong mga karapatan. So specifically mentioned in the law, those individuals with mental health conditions have the right for humane treatment. They should be free from discrimination and stigmatization. They can exercise all their inherent rights like yung social, political, or religious. So kung saan po nilang gustong pumanig or gustong sumali na religion, so be it. That is an exercise of their right. Confidentiality of all information, access to mental health services at all levels, participate in mental health advocacy, planning, and legislation. So it was specifically mentioned also in the law that they should be invited whenever there is a formulation of policy and programs or advocacy or anything about their conditions, they should have their participation. So kagaya rin po ng ating dinadrap po yung guidelines, meron po tayong mga naimbitahan mula po sa kanilang mga organization. Kailangan din pong marinig yung kanila pong panig when it comes to formulating legislations or policies and programs pertaining to them. Give informed consent before receiving treatment. So very important po ito na bago po sila makareceive ng treatment from a mental health professionals or a mental health providers, they should have that informed consent and appoint legal representatives. Moving on, wala po yung mga yon, it will fall under the punishable acts as mentioned in the law. So what are the 4 categories of punishable acts under RA 11036? So 1 is failure to secure informed consent, violation of the confidentiality of information, and whenever there is a discrimination against a person with a mental health condition, and those who administers inhumane or cruel, degrading, or harmful treatment not based on medical or scientific evidence. So, an example of inhumane treatment, kung maaalala po ninyo, meron po tayong mga balita or meron po tayong mga issues before na ang taong may problema po sa pag-iisip ay kinakadena, kinukulong po sa isang madilim na kwarto na tinatratong parang hayop. So that is not allowed by the law. So that is a punishable act. So ano naman po ba ang mga ating penalties for violations for violating the provisions of the law? On my next slide or moving on please. Meron po tayong penalties na sinasabi. So there is an imprisonment of 6 months to 2 years and fine of 10,000 to 200,000 upon the discretion of the court. So, yan po, no, iwasan po natin yon. Kaya po, sinasabi natin na kailangan mabago natin yung framing ng mindset natin or pagtingin natin to those individuals with mental health conditions. So, moving forward, sa batas po, sinabi din na merong identified focus areas. So what are these focus areas? First is the school. So kinakailangan pa lang po, sa start pa lang po ng pag-aaral ng mga ating mga anak or ng mga bata po, maimulat na sa kanila ang mental health awareness. Why it is important to take care our mental health. So sa murang kaisipan po, kailangan maipakita na po natin kung bakit at kung paano pangalagaan ang ating mental health. Because hanggang sa paglaki po niyan at pumasok na po siya sa workplace, madadala po niya yan. So another focus area is the workplace. So pag sinabi pong workplace, dun po pumapasok si DOLE. Yun nga lang po, as per our mandate, ang covered lang po ng DOLE is the private sector. So another focus area is at the community level. So sinasabi ko nga din po kanina that the approach or the access to mental health services is not only confined within those big hospitals. So kailangan po maibaba siya at the community level. At yan po ay dapat ma-access po ng lahat. Moving on, sinabi po na sa workplace, kailangan meron pong gawin si DOLE. So, in the law, there is a specific duties and responsibilities mandated to DOLE. So, sinabi po that DOLE should develop guidelines and standards on evidence-based mental health programs for the workplace and develop policies that promote mental health in the workplace and address stigma and discrimination. Moving on, nagkaroon din po tayo ng implementation IRR po or the implementing rules and regulations of the law. So it was reiterated in the IRR that DOLE shall issue appropriate guidelines in the development and implementation of workplace policies and programs in coordination with DOH and mental health experts. So ito po ay may usaping medical. So hindi po ito kakayanin mag-isa ni DOLE. That's why in the crafting po ng ating guidelines, we consulted Department of Health as well as our mental health experts. And also in the IRR, it was mentioned that DOLE should also develop mental health programs for OFWs. So alam naman po natin that our OFWs, lalo na nga po ngayon, they are vulnerable for suffering mental health issues or mental health problems. So OWA is taking care of the OFW portions po. And then provide assistance to employers in the development and promotion of mental health programs in the workplace, including access to mental health services. Moving on, that's why nagkaroon po tayo ng ating Department Order 208 Series of 2020. So it was signed in February of 2020. It was published in the Manila Times of February 17 of the same year, and it took effect po of March 4, 2020. Just right before po na ma-announce yung pandemic po or yung global outbreak po natin of the COVID-19. So very timely din po no yung pagkaka-issue ng ating guidelines, because during that time marami po ang nagkaroon ng fear, marami po ang nakaramdam ng uncertainties because of their employment, because of the situation, the adjustments na nangyayari on work and everything. Lahat po no apektado. But in the workplace, kinakailangan din pong pangalagaan yung mga mental health po ng ating mga empleyado. Moving on, ano po ba yung sinasabi under the guidelines? So employers shall develop appropriate policies and programs on mental health designed to raise awareness, correct stigma and discrimination, identify and provide support for individuals at risk, and facilitate access to treatment and psychosocial support. So it was reiterated that sa law po at sa IRR na mention po at inulit po natin at the workplace level po, kailangan or mandated po si employers na magkaroon po ng policies and programs on mental health. Moving on, ano po ba yung objective or yung ini-aim ng ating guidelines? Of course, it will give support for the effective implementation of the mental health work policies and programs in accordance with the different mental health assurances. So, dito po nakaangkla lahat po ng polisiyang ginawa natin patungkol po sa mental health. So, number one, we have the mental health law or the RA 11036, the Magna Carta for Persons with Disability as amended by RA 10524 and its IRR. So, those individuals suffering from mental health conditions are considered persons with disability. So, kung ano po yung na-enjoy ng ating mga PWDs under the RA, ganun din po yung mai-enjoy na benefits or rights po ni person or ni individual with mental health condition. And we also have the OSH law or the RA 11058. So our mental health policy and programs are integral part of the OSH company policy or the company policy on occupational safety and health. And then we have the United Nations Conventions on the Rights of Disabilities, the Safe Spaces Act, and other relevant policy issuances. So moving forward, so it for the scope and coverage, so nabanggit ko nga po kanina that it covers all workplaces and establishments in the private sector, including those which of the OFW or the overseas Filipino workers po natin. Now, tatanungin niyo po ako, papaano naman po ang mga nasa gobyerno? So kami naman din po, no, kailangan din pong pangalagaan yung aming mental health. So just like you, we're also experiencing fears, uncertainties, or yung mga needs din po namin pertaining to physical wellness. So yan din po ay tinitingnan naman po ni Civil Service Commission. So when it comes to the government sector, si CSC po ang may concern. So again, for the DOLE po, ang mandato po natin ay para po sa private sector. Moving forward, next on my slide is the formulation of mental health policy and programs. So as I've mentioned, ito po ay mandatory sa lahat po ng establishment, whether maliit siya, malaki, less than 10 po ang employees, all the workplaces should have their established mental health policy and program that would raise awareness, prevent stigma and discrimination, provide support, and facilitate access to medical services. Promote workers' well-being towards healthy and productive lives. So hindi lang po tinitingnan natin yung those individuals who are at risk or those individuals with mental health conditions, but we also want to protect the 80% good workers po, meaning yung, let's say, kung meron po tayong 100% na empleyado or 100 na empleyado, ang 10 po doon ay maaring at risk or maaari pong may mental health condition, we still have the 80% po. So yung 80% po na yun, kailangang pangalagaan din po. We don't want this 80% na magkaroon din po ng mental health issues. So we are on the preventive side. We need to promote workers' well-being towards healthy and productive lives. And if we're going to prepare a policy or a mental health policy, kailangan po merong participation from the workers' representative. If you are a unionized company, then you should have your union reps in formulating your company policies and program. Moving forward, also in the formulation of your company policies on mental health programs, policies and programs, it should be properly coordinated and monitored regularly as necessary. So again, actually, kung tatanungin niyo po kami, wala po kaming ginawang template specifically for mental health. What we did po is ilagay po natin doon sa guidelines that you may sought an assistance from DOLE on the technical side po, on the content, on the what is needed for compliance when it comes to DOLE. But the specific policy or program that would address the mental health aspects for the workplace, specific for each workplace, we recommend po na mag-sought po kayo ng assistance or mag-seek po kayo ng assistance from different organizations po or those mental health providers po. Marami naman po sila. The one we put in the guidelines po, we have the Psychologist Association of the Philippines, the Philippine Psychiatric Association, the Philippine Neurologic Association, the Philippine Guidance Counselor Association, and the Philippine Mental Health Association. So sila po yung mga kinonsulta natin during the crafting of the policy, during the crafting of the guidelines po. So according to them naman po, they are very willing to help establishments po to do or to have an assessment of their workplace mental health policies and guidelines, kung ano po yung appropriate for them po. So you can coordinate with them. Moving on. So now, what would be the important components and implementation strategies mentioned in the guidelines? So number one, sabi nga po natin kanina, there should be an awareness raising. So how can we do that? Through advocacy, information, education, and training. So at least the provision of basic information and education and mental health should be provided to all workers. So ano po ba yung mga basic information? At least how important is mental health, what are or the how-tos to improve their mental health, yung mga ganun po. And we can have naman that information po sa, let's say, from the DOH website, makakuha po kayo ng information about that and the World Health Organization. And then extension of its activities to the workers' families. So through your corporate social responsibility, so I believe meron naman po kayong mga ganitong activities. So we encourage po na kung meron po kayong activities regarding mental health, isama po natin yung mga pamilya po ng workers natin. Because of the family, malaki po ang naitutulong ng pamilya or the family support system to a worker with mental health conditions or suffering from mental health issues para po ma-improve yung kanilang mental health. Conduct capacity building of OSH personnel and HR officers, at least on the identification, recognition of psychosocial hazards, and management of mental health problems at the workplace. So as you can see, ang ating pong key players dito po ay ang ating OSH personnel and the HR people. So they need to be capacitated po. Then for the training needs, again, pwede po kayo makipag-coordinate with DOH, the National Center for Mental Health, or other mental health service providers. So marami naman po sila, and we in our website po, we have posted there po the different organizations po which can provide counseling services and as well as training, no? Nandun naman din po yung kanilang contact numbers or contact details wherein you can coordinate with them for the mental health trainings or information needed. Moving forward, we have another component is the promotion and enhancement of workers' well-being to have healthy and productive lives. So, sabi nga po natin, kailangan pong mapangalagaan lahat ng manggagawa po natin, whether it be a showing or those individuals who are at risk or at the same time, meron na po talagang problema sa pag-iisip. They should be need to take care of. So how we can do increase workers' awareness, promote healthy lifestyles and work-life balance, identify and manage work-related stress and stressors, manage effectively changes in the work organization and utilization of human resources systems. And I think dito papasok si HR personnel, si HR people po, no? Napaka-importante po ng role na ginagampanan ni HR people in this guidelines. Establish programs on mental health recognition, achievements, and efforts. So yung mga simple recognition programs natin, malaki po ang maitutulong yan para ma-boost po yung moral ng ating pong mga empleyado. And again, conduct of capacity building of managers and HR people. Moving forward, another component would talk about the social policy. So ito po, naging isang mahabang usapin din po during the drafting of our guidelines or in the formulating of DO-208. One is the non-discriminatory policies and programs. What we're trying to impart here is that these people who are at risk with mental health problems or those people with mental health conditions, they should be given equal rights in terms of promotion, hiring, and at the same time, yung mga benefits po na nai-enjoy ng isang empleyado ay kailangan maramdaman din or maibigay din po sa kanila. not because that they are suffering from a mental health condition, but it is their right also to be equally treated. So, kinakailangan po maibigay din po natin sila. And also, under the non-discriminatory policies and programs, we cannot terminate an employee of having such condition just because pinaghihinalaan po natin sila na may problema sa pag-iisip or meron na po talaga silang kondisyon. Now, but if the condition progresses to a severity, that's the time that the company can take actions. So, ano po yung mga actions na dapat gawin? So, all should be documented. There should be an assessment, or there should be a medical certification coming from the mental health experts that this person cannot really work na po or not fit to work. That's the time na po pwede po tayong umaksyon on the company policies pertaining to termination. Again, hindi po agad-agad na tina-terminate po sila na po. Meron pong prosesong pagdadaanan. Again, another, for the social policies, we have the confidentiality of information. So, it should be communicated and understood by all workers, prepared advance directive by the worker to form part of the 201 record, and bound by rules of confidentiality data under the Privacy Act of 2012. Moving forward, please. Okay, for the disclosure, we have the encourage, hindi po mandatory na kailangan po nilang i-disclose po yung kanilang condition. So what we put in the guidelines is that disclosure is encouraged. We encourage workers to disclose their mental health condition for purposes of reasonable accommodation. Disclosure of workers' mental health condition is allowed in any of the following conditions if it is required by law, consent from worker, life-threatening emergency cases, and administrative, civil, or criminal case filed against them. Next, please. For the work accommodation, so dapat po meron tayong prepared na work accommodations and work arrangement for those individuals who are undergoing treatment of their medical health conditions or mental health conditions. Moving forward, please. For the treatment and rehabilitation and referral system, so we do not mention naman din po in the guidelines that it should be shouldered by the company or ibibigay po nila ito ng libre with the employees po, no? So kung hindi naman po kayang magbayad ni employer, then they can refer it to the mental health services or mental health providers po. So the referral system would be very, very important din po, no? For as long as na kailangan, meron din po tayong ibinibigay na assistance po for the workers. So assistance in the form of referral, and then another is that the utilization of their leave credits. So moving on, for the benefits and compensation, so the usual din po. Now, under the easy claims po, kung ito po ay ma-identify po ni ECC na work-related po, then the employee can claim for the easy benefits po or easy compensation. Next, please. For the support mechanism program naman po, so we put there as counseling through referral. So, but then, if your company have these counselors po or meron na po tayong mga HR people with training on how to do the counseling, then it would be enough po. Pero kung wala naman po, they can refer it to our mental health service providers. Moving on, next on my slide would be the duties and responsibilities of the employers. So, this one naman po is generic naman po, no, to the all policies and programs that we are issuing po, no. So they have to develop, implement, and monitor the mental health policies and program. Then there should be a reporting mechanisms. Moving on, we also that the employer should also ensure adequate resources, provide necessary training, provide necessary work accommodations, the referral mechanisms, and ensure compliance to all requirements. Moving forward, please. So, kung meron pong na-mention na duty si employer, meron din pong duty si workers. So, they should participate actively in the formulation and effective implementation of the workplace policies and programs on mental health. They should provide assistance to their co-workers to improve their mental health conditions. Moving on. And hindi rin po sila dapat maging cause ng any bullying, harassment, or any forms of work-related violence, threats, shaming, alienation, and other forms of discrimination. So, kinakailangan po, no, maibaba po ito sa ating mga empleyado so they would know how to go about it kung meron po silang issues on mental health or mental health concerns po. Next, please. Now, for the keeping of records, so we need to maintain a medical records inside the company clinic po, no? But if the company clinic is not legally required, then the HR po can keep the records of these individuals po. But with the HR din po, I know na alam niyo naman na din po ito, I would just like to reiterate na hindi po lahat ng HR people ay may access to records. So there are authorized HR personnel lang po to go about with the records of these individuals. And then the companies are required to report cases to DOLE using the annual medical report. We're not asking for the details of that individual. All we want po is the numbers. Kung meron na po kayong cases, ilan po, saan, ano po yung ginawa, ano po yung programa ng company, ano na po yung status, something like that po. So yun po yung naka-reflect dun sa ating annual medical report form. So next please. And I think that is in the monitoring. So the implementation, again, it is the concern of our OSH committee. Moving on. Then the compliance would be part of our inspection activities po by the regional offices. And it should be dealt in accordance with RA 11058. So as mentioned, it is part of our occupational safety and health company policies and programs. Moving on, just like to share with you the DTI DOLE guidelines on workplace prevention and control of COVID-19. So it aims to assist monitor establishments' compliance with the minimum health protocols and standards. So we have developed a checklist on this. Moving on, please. Isa po sa indicators na titingnan po sa inyo ng ating mga inspectors is the portion of the workplace safety and health. And pagdating po doon sa indicators po na yon, meron po tayong indicators specific for mental health. So this is the increasing physical and mental resiliency. So there should be a activity na meron po tayo at our workplaces to keep our workers stay healthy and promote work-life balance. Then we also enjoin companies to provide free medicines and vitamins if they can po, kung kaya naman. And then provide psychosocial support or referral systems for workers needing counseling or presenting mental health concerns. Moving on, so these are just the statistics we have gathered or as a result of our inspection activities relating to mental health last year. No? So as you can see, we have monitored 71,878. So medyo mataas naman po ang compliance. So next please. For the penalties, so for any violations of the department, any provisions of the department order, then there is a penalty imposed to the company. So it will be in accordance with RA 11058 and to the Department Order 198. So meron po tayong mga nakastate doon na violation. So papasok po doon yung non-compliance of your company when it comes to mental health policies and programs. Next, please. So I think this will be my few last slides. So as you can see, isipin po natin na ito ay ating empleyado na nagsasuffer po or merong pinagdadaanan na problema sa isip. Now, this employee is afraid to come out of the open. Why? Next please. Because she feels scared. Scared of what? Moving on please. So, natatakot, no? Meron po siyang, moving on, natatakot po siya, no? Because of stigma and discrimination. So, hindi po niya alam kung ano ang gagawin niya. So, with you now, HR peoples that who are in this session, we encourage you to have those company policies and programs that would protect this kind of employee. So, as we can, the first thing that we can do is, of course, to remove stigma and discrimination. Moving on, please. So, if we remove stigma and discrimination, we show care to these people. And this care would spell out to your concern, acceptance, respect, and empathy. So to make these people feel na worth pa rin po siya, meron pa rin po siyang role to our community. And she can be, once given the proper interventions and treatment, this individual can go back to its normal life, moving on his. And if she can go back to his normal life, she can now contribute to the growth of our community as well. So everyone in this room po, we encourage now that you know po that we have these guidelines. Mental health is not just a responsibility of Department of Health or our mental health experts or the DOLE as well in the perspective of the workplaces, but all of us has a role to play in promoting mental health. So would the mental health advocates would say there is no health without mental health. So with that, we hope na pagbalik po ninyo sa mga companies po ninyo, no, you know that what are the components, what are the policies and programs needed to be implemented in your company. We do hope na makagawa na rin po kayo para sa mga empleyado po ninyo. And it would be a great help for us po in doing our jobs easily din po. And as well as in promoting mental health. So again, good morning. Thank you very much. And that would end my presentation. So for inquiries, you may call us at 1349, not only for mental health, but of all of the labor issues or labor concerns. You can call the DOLE hotline 1349. Thank you very much. Back to you, Ms. Catherine.
Thank you so much for that presentation, Ms. Jennifer. I'm sure our audience really learned a lot from that. So now I know you guys have a lot of thoughts and questions on the topic, so feel free to use the time to finalize your questions. So while you guys are jotting them down, it's time to reveal our second raffle keyword for this webinar. So our second raffle keyword is therapy. Again, our second raffle keyword is therapy. So I hope everyone got that word, and make sure you guys keep on track of all our raffle keywords. Here at Sprout, it's in our culture to keep practicing work-life integration. If you're down to learn more about us as a company, take a look at this video.
So you've got your processes, and your company is an oiled machine that runs pretty smoothly, but under the hood, you have problems. You've got managers desperate to know the status of their open positions. Leave requests getting lost in a jumble of emails, SMS and forms, and employees complaining about payroll errors. You've thought about some expensive custom software that would be a pain to maintain, or swimming in all the features of SAP or Oracle, or maybe even outsourcing your payroll altogether. Why can't you find a local, intelligent, well-supported software that caters to your needs as a Philippine company? Well, guess what? Here at Sprout, we've developed a system that just works. One system with all the features you need and without all those that you don't. So what are you waiting for? Get over to sprout.ph and get your systems fixed today.
Okay guys, so I hope you picked a thing or two about Sprout Solutions on that video. So before we move on to the fireside chat, it's time to finally announce our third and final keyword. Make sure you take note, guys. So our third raffle keyword is psychology. Again, our third raffle keyword is psychology. So to recap, our three raffle keywords are wellness, therapy, and psychology. To join the raffle, simply follow our Sprout Twitter page with the handle @SproutHRTech and comment these key keywords on our latest pin post. We will be choosing our lucky winner via Twitter, so make sure to comment your answers on our pin post. For the next portion of this webinar, we will be having a fireside chat with our speaker and panelists. If your questions are ready, be sure to type them down in the chat box. Now it's my pleasure to welcome back our speaker, Ms. Jennifer. And joining her, we have one of Sprout's legal experts, our very own Head of Legal, Attorney J. Ryan Trinidad, and our Head of People Operations, Shang Trinidad. Ladies and gentlemen, the floor is yours. You may now start asking your questions by using the Zoom chat.
Thank you, Kat.
Okay.
Magandang umaga, Miss Jennifer and Sean.
Yes, good morning. Opo, good morning again.
Okay. So our first question is, as we as an employer are required to have a mental health professional employee, right? Does this mean that we need some licensed psychologists to meet the minimum requirement? Again, we as employers are required to have mental health professional employees, right? Does this mean that we need some licensed psychologists to meet the minimum requirement?
Yeah. Thank you, Doc, for that question. No? Ideally nga po sana, no, maganda na meron po tayong licensed psychologists or mental health experts or mental health professionals at the workplace. But we do not mandate po naman po yan. Ano? What we do require po is to capacitate your HR people or your OSH personnel po. So you have, for those companies na meron na pong nurse, doctors, or they have their safety officers, which are the legally mandated, they can undergo the proper training. Then they can be called as the mental health professionals. So pwede naman po iyon na sila muna yung magkaroon po ng training and they can act. So it was specifically mentioned in the guidelines also na sila po yung ating key players po dito in the implementation of the mental health policies and program. So ang sinasabi po natin, those people po, the OSH personnel and HR personnel should have undergone the training requirement for mental health. Thank you.
Ma'am Jennifer, pwede ko po bang dagdagan yung sinabi nyo? So,
Yeah, sure. Opo.
tama yung sinabi ni Ma'am na hindi po mandated sa batas na magkaroon po tayo ng licensed psychologist sa ating pong organization, especially so na sa ngayon pandemya medyo talaga pong mahal ang pagre-retain po ng licensed psychologist, no. But ganun pa man, hindi naman din po limitado lang yung pong pagkakapacitate natin doon po sa ating OSH at saka po sa HR personnel, no. So kung titignan po natin yung pong guidelines na nilabas po ng DOLE, makikita niyo po doon na ang first po doon sa polisiya is dapat po meron po tayong advocacy, information, education, and training program. So in other words, pwede rin po yung mga kapwa po nating empleyado pagkatapos po nating makapacitate ang ating OSH at saka HR personnel, maganda rin pong ma-train po natin sila dahil sila po ang they can easily identify the symptoms and signs of mental health conditions among their peers na pwede po nilang ma-report doon po sa kanilang mga HR at saka po sa OSH personnel.
Alright.
Yes, that's
Sige.
true.
So, I'd like to add to what Ms. Jennifer and Attorney Ryan said. So, tama, we should undergo training, not just for HR and OSH committee, but better if yung mga line managers and then employees. May nakita kasi akong question dito, yung mga accredited. So, kung makikita nyo din sa guidelines, you can actually coordinate with organizations or associations providing mental health services. So, these are Philippine Psychiatric Association, Philippine Mental Health Association, and NCMH, mga ganon. And then, as mentioned, hindi required na merong licensed psychologist, but what we can do is provide services or facilitate access to medical health services to our employees. So that's important in any organization. And we acknowledge that not all companies have the means to do that. With Sprout, I'm really happy to be in an organization that addresses yung policy na to so that we're compliant. So we have Sprout Wellness. It's a holistic solution that we provide to our clients para mayroon silang access to these services. So we have licensed one-on-one consultations with licensed psychologists. We have meditation, we have yoga, and other services as well. So this has been really helpful during this pandemic, and I'm seeing moving forward in helping and providing support to our employees.
Ms. Kat, pwede bang tanungin ko lang si Ma'am Jennifer kung okay lang? So, Ma'am Jennifer, kung hindi po pala required ang isang expert or licensed psychologist, no, sa paggawa po ba ng mental health policy ng isang organisasyon, sino po ang pwedeng maging katulong po ng employer para po mag-draft po nito?
Well, sinasabi nga po natin na dapat po si mental health policies and program is integrated or core part po siya ng ating company occupational safety and health. So, ang frontliners po natin dito is our OSH committee, yung ating pong OSH personnel. But also, the companies can coordinate po with those mental health service providers na po pwede pong makatulong po sa kanila in drafting or in formulating their company policies and provide what are the appropriate programs to be provided. So, meron pong assessment na gagawin po kung makikipag-coordinate po sila with the mental health providers. And also, what we want po is that yung components po na na-mention doon sa guidelines should be followed by the company. Lalong-lalo na po on the raising the awareness of the employees, the correction for stigma and discrimination, kasi yun po yung number one na problema talaga. Why these people really afraid to come out of the open? Because of the stigma and discrimination they experience. So they need, the workplace needed to be assessed first para po malaman kung ano yung appropriate programs or kung ano po yung pagkakadesign ng policy. But what is important also is that they follow the guidelines. What are the different components of the guidelines? So yun po.
So, Ma'am Jennifer, thank you. But to summarize that and to incorporate that on how Sprout does it, kami, Ma'am, ang ginawa po namin sa pagdadraft po namin ng mental health policy, we make sure na yung OSH committee po namin ay nakapag-coordinate po sa mga mental health experts. Psychologists and psychiatrists included. So, ang ginawa po nila, sila po yung nag-formulate, pero hindi po agad namin kinaskade kung ano po yung polisiya na sa tingin lang nila. Ang nangyari po sa amin, nagkaroon po kami na natatawag na analytics through Sprout Pulse na kung saan po ay sinurvey namin ang entire mental health condition ng organization. Again, the reason for that is, minsan kasi when we talk about mental health, ina-isolate natin, when it should be escalated as an organizational issue, So, ang dapat po natin tignan is the mental health of the organization itself. At para po makuha natin yon, kailangan talaga natin i-analyze yung kabuuan ng kondisyon ng organization. So, ganun, Ma'am, po yung ginawa namin. And then, ang pinaka-importante po siguro, and I think more than the drafting and the cascading of the mental health policy, I think you need to have a specific action plans, para po maging buo, magkaroon ng meet yung policy po natin. Like, sa pagbinasa ba ng empleyado, ano ba yung mga kondisyon para ma-exercise ko yung mga rights ko? Halimbawa, kung ako ay stress, paano ko masasabi sa HR namin? Meron bang magre-retaliate kapag nagsumbong ako na bilang babae, nakaranas ako ng sexual harassment na nagdulot sa akin ng stress? So ito po yung mga ginawa po namin sa aming mental health policy. And we want to share this to our clients as well. Right now, if they want to approach us, just let us know. Tutulungan po namin silang gumawa ng mental health policy sa tulong din po ng mga experts po na amin pong kasama sa organization.
Thankful din po kami, grateful po din kami na we have this kind of activities because it really helps us, aminin ko na po, malaki po ang naitutulong ng mga ganitong activities or mga learning sessions po in providing information of the needed compliances for the company, So kasi kung kami po would rely on, of course, we do our orientations also with our own people, but to widen our reach, yung mga ganitong activities po or learning session really help our enforcement activities. So parang it's making our life easier also. Kasi during the inspection po kasi, so pagdating po ng ating labor inspectors at the establishment, they would look for where is your mental health company policy? Hindi naman na po nila yan tatanungin, paano nyo ba ito ginawa or what, but kailangan po nilang i-validate. So, are the contents of the policy are being followed? Are there specific programs provided for the workers? And should there be any concern, ano po yung gagawin ng empleyado? Or kung meron ba kayong referral system? So, those are the ways na binabalidate po ng ating labor inspectors. But and how are they going to craft or formulate a policy? We leave it to the strategy of the company. If you do conduct surveys or assessment tools, you make use of different assessment tools, then it will be fine. Kaya nga po, ang isang nare-raise din po sa amin before is that nasa ng template. Because in our previous OH programs, we have this kind of template. But as our experience po, this template does not 100% serve its purpose. As per my experience din po, i-share ko lang din that I was also an inspector or naging part din po ng activity ko is the inspection. So when we're looking at this specific OH program, kopyang-kopya po kung ano yung template namin. So even the company name, company ABC, pagpasok sa amin, company ABC, iba naman po yung pangalan ng company. So that's one reason why we do away with the template. Second, mental health is not just a parang ordinary mental health concern. It is a complicated one. Kaya sabi po namin, there should be a proper assessment to be done on what specific programs to be implemented and how this program be supported. Kailangan po may polisiya kasi doon sa polisiya may state kung ano yung dapat na gawin ni employer, and then it would be cascaded or it can be materialized through the programs, and during inspection yun po yung iba-validate with the company. And yun po, welcome din po sa amin yung mga pagtulong po ninyo with the establishments po. So just like in our website din po, posted po doon yung ating mga naging partners where these establishments can coordinate po. So if you have this kind of activity, then you can promote din po naman.
Ma'am, so ako na po magtatanong sa inyo. So alam ko po na ang DOLE is very active in providing certifications. No? Recently, naglabas po kayo ng certification kung health compliant ang organization.
Safety seal.
Yes, ma'am, safety seal. Tayo po ba magkakaroon din po tayo ng certification kung meron pong magandang mental health policy and program po ang isang employer?
Well, specific for us, mental health, wala pa po tayo, no po. But then in RA 11058 and its IRR, it was mentioned there that we'll be giving recognition system to those establishments who comply with the minimum occupational safety and health requirements. So as being said din po kanina, that mental health is part of the OSH compliance of the company. So yung atin pong law was issued last 2018 po, but because of the current situations now, hindi pa po kami nakakapagbigay ng award or ng reward system for that. But definitely, when it comes po yung ating reward systems on that, the recognition system on that, mental health would be part of that OSH compliance. So isa po yan sa mga iba-validate before we can give the award or recognition po in the future.
Thank you, ma'am.
Thank you.
Okay, a huge thank you again to our speaker, Ms. Jennifer, and to our panelists, Attorney J. Ryan and Ms. Shang Trinidad. So everyone, let's give them a round of applause. Unfortunately, that is all the time we have for this Q&A session. Again, I'd like to thank everyone who sent in their questions, and I hope we were able to address them properly. So for any e-certificate request, you may follow the instructions that you can see on your screens and can send your request through the link provided. You can also scan the QR code for an easier access. And now for the moment we've all been waiting for, I'd like to announce the Lucky Raffle winner. So our Lucky Raffle winner is Maan Sarigumba. Again, our Lucky Raffle winner is Maan Sarigumba. So congratulations for the winner. Please send us a DM on Twitter so that we can send you the Shopee GC codes there. Again, thank you everyone for participating, and have a great day ahead.